insurance company CEOs and state insurance commissioners were at the White House today for a meeting with Health and Human Services Secretary Kathleen Sebelius. Secretary Sebelius said the meeting was held because Americans are frightened by insurance rate increases at private companies, and they're afraid that their own insurance rates may be next. With us now is David Cordani, the CEO of Cigna. He attended today's meeting. Mr. Cordani, welcome to Bloomberg News. Thanks for joining us.
Good to be here. Thank you.
Sir, talk to us about what your message and the message of your colleagues was to the White House today.
It was a pretty simple message. First, we recognize that the current state of premium growth is unsustainable for American families as well as businesses. And second, that we need to get to the fundamental driver of those premiums, which is the underlying costs, medical costs driven by pharmaceuticals, device manufacturers, hospitals, and the like.
Any ideas how you tackle that right now?
Sure. We spent a good amount of time with the Secretary and a brief amount of time with the President talking about the use of transparency, so providing information for consumers around quality and cost, aligning incentives, and then making sure the right programs exist to help individuals manage their health and improve their health status over time.
So how challenging then is it for you right now to forecast your financials with this ongoing uncertainty of how health care reform, if at all, will ultimately pan out?
Sure. Relative to our financials, as you know, we make an annual forecast each year. A fair amount of our contracts are locked in the United States for that portion of the business, are locked in the January timeframe. I think really what the cost we're dealing with is the cost in the out years of 2012 and 2013, as eventually the system will evolve and change more rapidly.
So what are your forecasts then near term with healthcare where it stands? Do you expect to have to continue to increase premiums and lose subscribers?
Sure. The majority of our business in the United States is service business. So we act as a fiduciary for our large and middle-sized employers. So for those individual employers, they actually see the actual medical cost each month, each quarter. And we've been doing a good job over the last several years managing their medical costs. For example, in 2009, on average at about 7.5%. And we expect to deliver about an 8% medical cost for those employers in 2010.
Mr. Cordani, how do you respond to insurers who have been saying that the legislation in its current form is missing any serious cost controls?
We believe there's two major pieces that the legislation needs to have. Fundamental access expansion, so everybody could have access to affordable health care, which the legislation has a meaningful amount of constructive reform in. That needs to be coupled with sustainable improvements in healthcare quality and cost. And we believe the current legislation is light on that. Recently, Senator Dashiell also came out indicating that the current legislation is still light on the cost improvement side of the House as well.
The likelihood is here that there won't be a public option. So does that take some of the pressure off you as CEO of Cigna to not now have to streamline operations, perhaps not to have to eliminate jobs, make other cost-cutting measures?
For Cigna, about 60% of our company is U.S. healthcare. A good 20% of our company is outside of the U.S., and the residual is disability and life. For the healthcare business, our business is around middle and large-size employers and increasingly growing with 100 to 200 life employers. Over the near term, we see a tremendous demand for our services as employers are trying to line up the incentives and the health improvement programs for their employees and their family members. And we expect to see that over the near term with or without a public option alternative.
Mr. Cordani, we have about 30 seconds left. Last week, I had a chance to interview Dr. Herbert Pardes, the president and CEO of New York Presbyterian Hospital. And I framed the question this way. Aside from the politics, is what's been lost in this debate the fact that health care reform, health insurance reform in this country is a moral imperative?
Healthcare reform being a moral imperative, I think all parties agree that access to affordable health care for all Americans is the right goal and the right objective. So if you correlate that to a moral imperative, I think there's broad agreement on it. The challenge is how do you do it such that the overall cost and quality continues to improve such that it's sustainable. That's, I think, where the devil's in the detail right now.
David Cordani, CEO of Cigna, joining us from our Washington bureau. Mr. Cordani, thanks so much. We appreciate it.